Hello, welcome to the live session.
Hi, Rosie.
Yes, sir. So we'll begin now. Firstly, hello everyone. Welcome all our viewers. Welcome to the live session about sexual health and diabetes in collaboration with Andregn Clinic. During this live session, we will take up diabetes-related sexual complications only. So please feel free to comment below with the same. Today, joining us, we have Dr. M.Natesh Prabhu, Director and Men's Health Consultant from Andregn Clinic, located in Trichy, Tamilnadu. He's been practicing there for more than 5+ years. Thank you, Dr. Prabhu, for joining us today. A warm welcome to you.
Thanks, Rosie, for the warm invitation. It's a pleasure to do the program for BTO. So I've been with BTO for the past 1 year, and it's been a good journey because I tend to see a lot of diabetic patients. And BTO has made this very, very easy for patients who can connect in a smart way with their own diabetic management software. And there is an end-to-end, like a communication where there is a sexual medicine expert and some ENT expert, which you have last time, dietitian, you have various things. So it's a very smart way to manage diabetes, especially in this COVID pandemic situation, because people might get lost, or they will lose their follow-ups. They might tend to skip the medications. So this will be a very good approach for them, for anyone. And kudos to BTO. And let us see how we're going to do this program here. And I invite my own patients here, my audience here. Please feel free. If you have any doubts, you can post and on the Q&A session. Or if you have any other questions which you are unable to ask, please message on the BTO messenger or our own Andrew messenger. And so we have a team. They will be forwarding your questions to us. So feel free. And we're going to talk about sexual health and diabetes.
Thank you, sir. So on that note, we'll begin this session. My first question to you is, how can diabetes affect a person's sexual health?
Cool. Good question. See, as a person, being a men's health consultant, I'll emphasize more on men first, then I'll come to women. And coming to men, we can think about diabetes affecting both components of a sexual activity, which is called as erection as well as ejaculation. People tend to see this as one common thing. No. So these are two processes. One is called as the decreased erection. For erection, we need a good vasculature. And we all know that diabetes affects arteries, diabetic arteriopathy. Then diabetes affects nerves. So for any good erection, there has to be a neurovascular component. It's called as neurohormonal vascular interplay. And when it comes to diabetes is going to affect mostly the arteries and also the nerves. But a prompt management, a smart way, with a frequent monitoring of blood sugar levels, with adequate HbA1c control, will play a major role in protecting the arteries as well as the nerves. This is one way for maintaining the good erection potential for men. When it comes to the ejaculation, nerves, there are many nerves which control the function of ejaculation at the bladder and neck. So when there is uncontrolled diabetes or any diabetes-related complications, the nerves, they lose the control. So what happens? The patient tend to have a retrograde ejaculation. They won't be able to pass the semen in the forward direction. You'll go again back to the bladder. That's called the urinary bladder. This won't be of a big problem because the person might be able to get good orgasm. But when there's a young man who is going to plan for the pregnancy, and if he is not able to inseminate his female, then he will be end up in having an infertility problem. So this is a very, very important concern because we have to make him ejaculate in forward direction. And for older men, what happens? They don't have the sense of fulfillment until they see the semen coming out. So this can cause psychological ED also. So it can present in multiple waves, Rosie. So it is not only one common thing. People think diabetes can affect my erection. No, it can affect erection. It can affect ejaculation. And third most important thing which I want to emphasize here is diabetes can cause penile foreskin injury. It is called as melanocytis. What happens? Patients have frequent infection in the foreskin. They tend to come for the follow-ups. Mostly it is antifungal. So we'll be giving them fungal medications, and we'll be asking to get the sugar under very good control. This, when it keeps on repeating because of the poor control, this causes scarring of the penile foreskin. and they end up in called as phimosis. They can't retract the foreskin. So we have to go for this circumcision surgery. So they won't come out very easy because of the shame, shyness. So they will be having pain during intercourse, which can culminate in a psychogenic ED. Because what they think that once I'm going to insert now, once they get an erection, then the foreskin stretches. It causes a crack-like thing. So they'll be having pain. So they tend to have this pain. So they lose erection. So diabetes can affect erection dysfunction due to the affection of the arteries and nerves. Diabetes can have ejaculatory dysfunction due to affection of the nerves. This can culminate in infertility. And third, it can affect the foreskin. And one more important thing, diabetes can also cause poor semen parameters because diabetic patients are more prone to get infection of their male accessory glands, which is called as MAGI, which is called as male accessory glands infection. They might even have prostate infection. So their semen might be having more amount of WBCs, which can end up in giving something called as reactive oxygen species. Again, the sperm quality might come down. So here, diabetic management is a huge important thing for anyone who is having a fertility issue also.
Thank you, sir. And how does it affect women who have diabetes?
Yeah. For females, what happens, again, when comparing their genital area, there's a part called as a clitoris. This clitoris is akin to the male glans penis. So when the patient is having uncontrollable diabetes, they're obese, what happens? The artery gets sclerosed. So their ability to attain the orgasm is compromised here. They won't be able to get the orgasm. They won't be able to get the pleasure feeling out there. And second thing, arteries supplying the vagina, it also goes for some kind of an arteriopathic changes. So it is a compromise. So they won't be having vaginal lubrication. So what happens? They tend to have pain during the intercourse. It's called as dyspareunia. Very, very significant because once a male part inside the penis, they'll be having pain and they tell to withdraw the penis. Then what he might think that, oh, I'm not able to perform well. So he tend to have a psychogenic ED also. And on the other hand, because of poor orgasm due to a clitoral erectile insufficiency, they'll be asking the men to perform more. There is any limitation for any man to perform because he can't keep on pumping on the women because of fatigueness, because of age also, because of tiresome, boredom, because of the same position, multiple things happen. Again, men, they might lose erection. So females, they can achieve the orgasm. They will be having poor lubrication and they will be having like you will have good sexual pleasure. So these are the multiple ways where it can affect the sexual activity.
Thank you, sir, for answering that. Now moving on to say somebody who has diabetes, what are some signs and symptoms that they should watch out for in order to recognize and then, visit you and get professional help regarding this?
Yeah, when they want to visit me, the first sign is they lose erection. That is one thing. But as a known cause of diabetes, you don't know that tried out there. Polyphagia, polydipsia, and polyuria. They tend to eat more, they tend to drink more, they tend to urinate more. But when it comes to meeting me, because I tend to tell my patient that patients who present with erectile dysfunction, in them 12 to 14% will be having an unknown diabetes. So diabetes doesn't mean that it can present as increased appetite, increased urination, or frequent nocturnal urination, or weight loss. It can also present with ED. Patient when they present with ED, I have seen patients HbA1c of 10, 11, 12, very early 14 also. Their sugar levels are 350, 400. I'm surprised they don't have any other complication. They're present with ED. So I always tell that erectile dysfunction, it is not a disease per se. It's a symptom or a sign of an underlying disorder. When it comes to diabetes, yes, patients with diabetic patients can present with erectile dysfunction.
Thank you, sir, for answering that. Now, could you expand a little more on what is it about diabetes that results in erectile dysfunction in men?
Pardon, come again?
Could you expand a little more on what is it about diabetes that results in erectile dysfunction in men?
Yeah. About diabetes. Okay, fine. See what happens when there is uncontrollable or when there is two components in there. One, either the patient present with short duration of diabetes, but it is uncontrolled, or the patient is having a long duration of diabetes. In both the cases, the patients are prone to cause or have some difficulty in, have some disease of the arteries. I can show you some images. Let's hold on a second. Sorry for that. Yeah, I can show you an image here. You can see that this is the penis structure over there. Okay, this is a person's unerect penis. Hope you can see that, right?
If you could, yeah.
Yeah, this is an unerect penis. This is a fully erect penis. What you can see is called fully engorged blood in this. When there's a fully engorged blood, the penis goes for good erection. In diabetes, this engorgement is affected. This engorgement is affected, one, due to the poor arterial supply, and second, for an engorgement, we need a nitric oxide. It is called as neuronal nitric oxide. That is lost because the nerves also get affected in diabetes. So I would say for managing diabetes, the first step is proper diabetic control, and second step is addressing the endothelial dysfunction, which I think we can discuss in further steps.
Right.
Have I answered the question?
Yes, sir.
Yes.
So as we talk about diabetes, we talk about, the impact of having high blood sugar on all your organs. Similarly, does low blood sugar also have an impact on the sexual health of a person with diabetes?
Good question. See, for example, there is something called as frequent hypoglycemic episodes in case of diabetic patients, very specifically when they are insulins or sulfonylureas. Because of multiple factors, the dieting, the routine activities, or the genetic makeup, or the diabetic levels, few patients, they might go for hypoglycemic episodes. When they go for these kind of episodes, they will be having something called as hypoglycemic awareness. They get tachycardia, sweating, palpitation. They have a sense of hungerness. So they want to eat something else. So they have a fear that they might go for hypoglycemia. So they tend to overeat. This causes, again, poor control of diabetes. And again, the crux, again, I told you, the poor control of diabetes can have ED. So it is not about low sugar causing ED. It is about the cycle, the low sugar making them eat more, which again results in hyperglycemia, again causing ED. So they have to monitor the sugar level. I've seen many prescriptions, people write for 3 months, and patient has to monitor it at least for 1 month, because sometimes we put them on a strict diet regimen. I personally put patients on diet regimen, yoga pranayama therapy, lifestyle modifications, exercise therapies, high intensity interval training. So depending upon the age groups, and once you put them on these regimens, you have to monitor very closely, because when they're very strictly physically active, you have to tailor the drug dosages. For example, I would have started them on, for example, 1 milligram of glimepiride or 20 units of insulin. Mid of the month, they might be having a good sugar control. And when you're going to continue the same dosages, they might have a hypoglycemic episodes. So initial period, I will ask them to monitor the sugar at the home. And now with the smart app monitoring, they don't have to come again here. Once they see that we'll be getting a pop notification and everything goes well, simple thumbs up, they will continue that. If it is not going well, and they might be want to visit me again, or anyone to visit. So that is where this smart management comes into big role. So they have to manage the sugar levels. That monitoring has to be frequent accordingly. Hope I'm clear with the explanation, right?
Yes, sir. And how you mentioned about diet. So what does, a healthy diet for a person with diabetes and sexual health issues, what does that plate look like?
Okay, see, I'm addressing this from South India, okay? And things varies across India, because we can't tell what is a strict good diet. What I would say is that what I personally give my patients, which is common for South, North, East, or West, because I get patients all around, because of online consultations, I have a good experience of seeing multiple patients. I generally put them on a very strict diet of very, very limited amount of carbohydrates. If, for example, if there is a South Indian diet, I'll tell them, please cut down on idlis. If it's a North Indian, please cut down on chapatis. People think that chapatis are safe. Chapatis are equally high in glycemic index. There should be limitations. I put them on something called as, like channa. I don't know about Hindi term. I can tell in Tamil. Used to call as pair, sundal, in soya, like rajma, methi. Put everything together, soak it in the water. Next day, you just boil it and eat it. For filling sake, you can have your own dish, one idli, or a little bit of poha, or half chapatis, or half dosa. That will be fulfilling for you. Along with that, you always take a good egg meal, because that is going to give a fulfilling for their stomach. Because people tell, like whether can I eat bananas or fruits? Yes, of course you can eat. Absolutely no juices, because juices will increase the sugar levels very much drastically. After a walk, after a jog, after an exercise, please take banana. A very good packet banana is very, very good. And pre-exercise, you should take some nuts also. And your morning breakfast should be of cereals. I'm not supporting your oats or muesli. No, simple homemade cereals and pulses is the best for them. And make sure you can have a brunch. Don't skip the brunch. People tend to overeat in the day and they go wait till the afternoon. This will have some kind of a panic attacks. When we eat next? Have a couple of biscuits or a green tea or a black coffee with lemon. I always tell the patients to avoid milk, because when there's diabetics, there is insulin resistance. And when you're going to give more milk for them, milk is going to promote more insulin resistance. So avoid your milk coffee or milk tea. Have green coffee, have black coffee or green tea, and then have your lunch. Lunch is about small amount of rice or whatever you have, more amount of vegetables, palak or paneer, what you say, and more amount of a little bit of curd. Then have a snack in the middle of the, like how much you can space. For example, if you're going to have a lunch at 2 o'clock, have a snack at 5 p.m. Then have dinner at 8:30 or 9, because you're going to sleep by 10. I can't say 8, because nowadays I have not seen anyone eating at 8. Very tough, because we tend to extend the work. Let's be practical here. So I will tell them at least have a 2-hour gap before you sleep. If you're going to have a sleep cycle of 12 o'clock, make sure you're going to finish by 9:30 at least. Then go for a small walk. Don't again go and sit on like a watch movie or go with the phone. Just go for a small walk in your terrace or on your local place. Just 5 minutes walk. It is going to boost up your metabolism. The key here is how you're going to keep your resting thermogenesis on the upper side. What do you mean by that? Even when I'm not exercising, I should be able to digest what I eat. Diabetes is a metabolic disorder. You can see a lean person eating well or a fat person eating well, still no diabetes, because they will be having good metabolism. I've seen many lean diabetics, they eat very little much, but still the sugar levels are not very controlled. It becomes their metabolizing genes have been shut off. How to activate it? Again, good diet. Fruits, vegetables, cereals, pulses. It is going to activate the genes to produce the necessary metabolic enzymes to maintain the sugar levels. This is the key here.
Right.
Apart from the sugar, apart from your, insulin or medications, there is no cure for diabetes with medications. The cure comes only in the lifestyle management, your diet, exercise, everything. And how you manage your stress. We'll talk later about that, because you're talking about diet now.
Yes, definitely true for type 2 diabetes, sir. Another question that this brings up is, so how you talk about, it is important to have these lifestyle modifications in order to gain control of your diabetes. So does following a good diet have a direct impact on sexual health, or is it more like you follow a good diet, you do your regular exercises, which keeps your diabetes in control and thus reduces all the issues related to diabetes?
Excellent question. See, there is something called as gut-brain axis. Gut is called as a second brain. So whatever you put inside, your body is going to assimilate it and it's going to respond. So when you're going to put a lot amount of oily foods, or you can say a lot of masala items like, barbecues, kebabs, like whichever is it, because people don't eat nowadays, like a lot of mayonnaise, a lot of shawarmas, Night times are filled only because they tend to work a lot during the daytime till the evening. At night times, they won't have a good stress relieving things. Some people go for alcohol. Some people go for a good amount of food. They call it foodie. So, of course, diet plays a major role. How to play a major role? It is going to reduce the stress on your digestive tract. When you're going to put a lot of stuff which has a lot of masala or artificial items, it is going to take more amount of stress for it to digest. It releases reactive oxygen species. This ROS will numb the hormone system. It will decrease blood supply to the pulmonary organs in a direct way. Indirect way, it is going to make people dull. So there is no central stimulation and they'll feel loss of libido. They come out very tiring work. They eat some some chicken or a lot of paneer, some gravy, and they think, doctor, I'm not getting erection. Of course, the whole blood supply is focused towards your stomach. So then how do you expect the blood supply to go below the stomach? And very bad habit is that they come, they eat, and they tend to go to sleep immediately, and they expect to perform immediately. Not possible. Always give a span of 1 hour from your food and your sexual activity. That is, I'm telling you, keep your night food light to have a good sexual activity.
Thank you, sir, for that answer. Moving on to the subject of pre-diabetes, could you tell us a little bit of if somebody has pre-diabetes, are they prone or more prone to developing sexual health complications?
Yeah, see, pre-diabetes is one of the component of metabolic syndrome. Persons with pre-diabetic, they will have obesity, they will be having insulin resistance, they'll be having fatty liver, plus they'll be having this erectile dysfunction. So it is kind of a common presentation. When a patient comes with ED, we might detect a pre-diabetes. Or when the patient comes with a routine checkup, and when you see a pre-diabetics, we tend to put them in a question is called as International Index of Erectile Function question, because some persons, they may not accept that the doctor can be asking, how is your sexual function? For example, a gentleman of 60 years, we can think why he needs sexual activity. No, I get patients of 85 years. So sex is important at every, a section of age. So you need to give the questionnaire, they filled it, and this shows that they want sex and they cannot perform sex. So once you address these pre-diabetes issues, the sexual activity will resume well. Because both of them have a common pathophysiological factors. You can see that.
Thank you for that, sir. Now, another question I would like to ask is about how can men with diabetes and sexual health issues have children?
Of course, they can have children. Yeah, of course, there is nothing like that. They can't have children. But when they're planning for pregnancy, as I told you earlier, diabetes can affect fertility in 3 ways, maybe in 4 ways. The one is they won't be able to perform well, first of all. And second, even when they're performing well, because of the penile foreskin injury, the semen parameters gets infected, so they can't. So they'll be having good semen being what can I say, inseminated. And third, they might be having retrograde ejaculation because the semen goes back to the bladder. And fourth, because of the infection of the accessory glands, they might be having a poor sperm pattern. That means there will be a more amount of WBCs, which will cause oxidative stress on the sperms. What do we mean oxidative stress? Sperms need to have a good environment. If that environment is compromised, the sperms cannot function well. So they will be having low motility, poor morphology, and sometimes more amount of oxidative stress can cause low count also. So these ways, diabetes can hamper fertility. But of course, a proper diabetic management will be helpful to them for maintaining their fertility rate, and they can have good, a good pregnancy. Same thing goes for females also, because I'm not addressing females here. A proper diabetic control is highly essential for them to have a good fertility potential.
Thank you for that, doctor. Now we have a question coming about, how can we reduce these risk factors related to sexual health that are associated with diabetes? So, what are the treatment methods available? Are these conditions even reversible? If yes, how can a person reverse it?
Good. See, there is no one solution for every age. So it all depends upon at what age they are presenting and like what is their baseline severity. For example, if the patient is coming at 70 years of age, I won't be focusing on reversing the ED for him. I'll be focusing on giving back his sexual life because he might not be performing for us at 10 years. We don't know history, right? But similarly, when the patient is coming at the age of 20, he might be having our early stage of the disease. So that we'll be assessing him. We'll try to reverse disease, 20 or 35. For example, a middle-aged man around 40 years of age is coming. We have two scenarios. One presenting with grade 4 ED, one presenting with grade 1 ED. For a grade 4 ED, I mean very severe ED, my aim is to make him to respond to the medication first. Then to downstage the disease. From grade 4, can I make it to grade 3 or grade 2 or grade 1 or medication free? I'm not using the word cure here because cure is only for infectious diseases or a pain management. This is all life diseases. How are you going to make them a medication free? And how long are you going to make them for like without drugs? We all know we have drugs like sildenafil, tadalafil, varnafil, like Viagra, Cialis. We have a multitude of drugs. These drugs will improve their sexual performance. It won't cure the sexual dysfunction. Proper diabetic management, proper lifestyle management. Lifestyle means weight reduction, stopping of alcohol, stopping of smoking, and proper sleep hygiene. Many don't sleep properly. Good exercise activities, fat loss, not weight loss, fat loss. And most importantly, they have to have a good exercise routine. It is not like for 1 week, I go for jogging, then stop it. No. Along with that, their own proper diabetic control. It is going to play a major role in reversing the endothelial dysfunction. Apart from this, we have various therapies like PRP, is called as platelet plasma, shock wave therapy. We have to evaluate the patient. We have to see how good is endothelial functioning, how good is their vascular muscles. Based on that, we will be personalizing the option for them. It is not for all. And of course, we can try for different age groups, and we have to see that whether this type of PRP therapy or shockwave therapy, it is going to downstage disease. Because the previous notion that the patient is not responding to the medications, they have to go for penile implants. Absolutely not. I personally have seen, even my chiefs have seen, we have seen many patients who are not responding to oral PD-5 implants, called as Viagra or Cialis or these medications. They tend to re-respond to the medications when you're going to treat them with PRP injections or shock wave injections. Again, we have to see the protocol. Not all PRP or PRPs. We have to standardize it, how to activate it, how much to give, and what are the shock wave therapy protocols. How much to give, how much Pascal bar energy to be delivered. These matters here because there are many centers where they deliver unscrupulous shock wave therapies, unscrutinized PRP regimen therapies. It will be effective for them. So they have to very, very strictly assess what is their own personalized management. I think now, like with the Google thing, patients, they read a lot and they make our work very much more easier because they tend to come, doctor, I need this therapy, how will it be helpful for me? And until I make the HbA1c come down to at least to 7 or 7.5, I won't venture into these therapies because first step is diabetic management for this set of patients.
Thank you for sharing that, doctor. Next up, how you mentioned about medication, and you talk about treating the causes and not just the symptom. Now, moving on from that, and we've also covered diet. So my next question would be about supplements, because we've heard a lot about taking supplements to boost sexual health. Is that something you recommend for people with diabetes?
Again, all depends upon age groups and what supplements you're taking. There are many online supplements. We have to see the manufacturers, and we have to see, because people think supplements are free of side effects. Absolutely not. Whatever you put in your mouth are prone to cause side effects. Even the food you take, gastritis, nausea, vomiting, flatulence, everything is the side effect of the food you're taking. So patients, they come with allergy, they come with photosensitivity, they come with severe gastritis while taking, say, supplements. Supplements, of course, they do have a big benefit, but not on an acute basis, on a chronic basis. They have to be supplement for long term. And we have to see what supplement. I've seen LRC supplement, I've seen fenugreeks, I've seen shilajit, I've seen ashwagandha. People ask, how do you prescribe ashwagandha being an allopathy practitioner? Very simple. It is all about the manufacturers. Ashwagandha is a plant. All depends on how you will prepare it. Ayurvedic practitioners, Siddha people, they prepare in a different way. Like in allopathic practitioners, we call as nutraceutical supplements. So the preparation varies. So we have to see what is a supplement, how much dose. You can't over prescribe the patient. And of course, only supplements won't be helpful. As in people buying multitude of supplements from the online, they come, doctor, I spent on 25,000 rupees on supplements. Absolutely pathetic. And most importantly, people come in camps, like offline camps. They come from different states. They sell for 50,000 rupees. They make people's shyness. They sell something. They come to me, and they've seen any doctors. They tell, I have spent so much on the medications, and they come and they'll make me complete medication free. That is quite tough for anyone. So supplements do have a big role, but what supplement, at what doses, and how long should be discussed.
All right, doctor. Thank you for that. Now, say you had to sum up and give us 3 top tips to boost or for people with diabetes to have better sexual health. What would those 3 tips be?
One which always everyone knows. Of course, you have a diabetes control, How to control that? You go and introspect yourself. Am I doing the right thing? Am I waking up at the right time? It is not about waking up at 6 o'clock. No, it is about a 6 to 7 hours of deep sleep. The moment you wake up, you feel refreshed. You should not feel that, oh, I woke up today very tired. How am I going to follow up the day? No. Fresh sleep, number 1. That is going to cause good diabetes control. Second, stress-free life. Because once you are stressed, it is going to increase the cortisol. Cortisol is a pro-diabetic hormone. How much were you be strict on your food? How much you are strict on your exercise routines or your medications? Once you always stressed out, you cannot be controlling the diabetes. No. Now, what is stress for them? Unpleasant situation or activities is stressful. It could be a workplace. It could be personal issues. It could be toxic relationships. It could be anything. So it's an introspect what is stressing you. Once you come out, then automatically you can see that your diabetes can be controlled. And how to augment the stress relief? Again, pranayama meditation is going to augment their own stress relief. Apart from this strict diabetic control, what I will see is mindful eating. People see mobile phones, people read books, people see videos, and they tend to overeat. You can tell I can have a good diabetic control, but still, if you have to have an improper food at an improper time, it is going to affect your erection potential. Or in case of female, also it is going to affect their orgasm potential because improper food, at vague timings, it is going to affect their pelvic blood flow because of a gastric upset. So again, mindful eating. And of course, a third is your frequent monitoring. That means monitoring means not only your sugar level monitoring with the devices, monitoring your weight, monitoring with your, how frequent you are with the reviews, how frequent you are with medication. Because I have seen different patients who get very well, who stop medications because they think they're cured. They end up in a very bigger problem. So I told you 3 things. One is proper diabetic control. In that I have told you a stress-free life, exercise, everything comes to like proper dieting. And second is mindful eating. Not like gulping, seeing, multitasking. Don't do that. And of course, what is that? A third factor. So these 3 things has to be enrolled for anyone to have a good sexual function.
Thank you, sir. There's a question coming. It says, is it safe for people with type 1 diabetes to participate in sexual intercourse? Would they be at risk of having low blood sugars?
there is no relationship, because for example, they're thinking that when you're going to have sexual activity, it is going to lower the sugar levels by increasing the physical activity. Once they are on the optimized insulin regimen, it is not no need to be frightened about. Nothing like that. They can have a good sexual activity.
Yeah. Thank you for that, doctor. And now moving on to the subject of, infections and STIs. So we already know that people with diabetes are more prone to infection. So could you tell us a little bit about, are they also more likely to contract sexually transmitted infections if they have diabetes?
Diabetes doesn't mean that they have the high probability of having STIs. They have high probability of having severe STIs because their immunity is lower, right? So they tend to have their very fully flared diseases. For example, even a mild gonococcal infection can be a full-fledged infection for anyone. So they have to have a full-fledged infection because of the lower immunity. I want to emphasize here that, see, STIs has to be addressed at a very important level. Why? Because patients, once they get the infection, they feel shy and they end up in a much more severe disease, which is quite challenging for anyone to manage. So, like, moment you feel that you are having you had exposure either accidentally or any unknowingly you went out of your own emotions, please visit the doctor, get it addressed at the earliest so that you can not only safeguard your health, you want to safeguard your partner's health also, because not exposing this to a partner puts them also in the risk. Holds both for the males and females, both of them.
And sir, if it's vice versa, is it true that if somebody has an STI, it also results in an increase in their blood sugar levels?
Any infection has the potential to cause blood sugar level increase because of stress levels again. So STIs, when there is overwhelming STIs, it may have a impact on the sugar levels.
Thank you, doctor. I think I'll take the last question for today. So I really want you to address, how there's so much stigma around people openly talking about sexual health issues. So I would really like you to emphasize on how it's absolutely novel. And in fact, it's the right thing to do to, visit a professional like you and get help for the issues that men and women are facing.
Yeah, see, people have to think about that sexual dysfunction. It is not a disease. I can emphasize it is a health issue. So this is what I emphasize to all my patients, that when you have any sexual issues, when you have any health issues, the first thing you want to notice is loss of sexual functioning. When the health is regained, the last to come back is good health, like a good sex. So most importantly, females should make the male partner more comfortable, give more encouragement to go and visit a practitioner, sexual practitioner. This is treatable, not to someone blame that they're not performing well, because I have met a patient, his name is on YouTube. His name is, I forgot the name. He's in Gujarat. He had a penile implant surgery. Only because of his wife's support, he was able to go through the surgery, and now he's having 2 children. So the moment he had this second child, he messaged my chief. Then I was luckily I was at Gujarat for some training program. Then my chief, he called me. He told, why can't you go and meet him? He wants to give an interview. His name is Shuvesh Abhiyani. I'll mention his name. Just hold on a second. I have his name on his name on Sarvesh Biyani. Yes, I want everyone to watch the interview, Sarvesh Biyani, where family support for him, for his problem, made him to get back into his family life. He is having 2 children now. I have seen many persons, they coming with suicidal thoughts, not willing for marriages, coming for divorce, not addressing this issue at the earlier stage. This being young chap, he was 26 years old age, I think so, when he had a first implant. After 5 years, having a second child, he want to open up. He want to tell his story to everyone. The story is available on YouTube. You can type his name as Sarvesh Biyani, penile processes. Please stay pop up. And as I told you, stigmata should not be there. It is between you and a partner. Please address it at the earliest so that you can prevent the disease progression and you can reverse the disease at the earliest.
Thank you so much for sharing that, Doctor. Do you have any parting thoughts?
I feel very happy to address this interview because being this COVID, people tell is lockdown, but it has opened up many avenues to reach out to people because online consultations, these webinars, these interviews, this has made people more aware than they were aware before that for past decades or so. People now know what is happening with them. They just have to know what is right for them. So that is where they have to approach the right person to get a consultation and get it treated at the earliest.
Thank you, Doctor. To all the viewers who are watching, thank you all so much. If you'd like to book a consultation with Dr. Prabhu, I request you all to please download the Beto app. You can visit www.betoapp.com/download. It's also listed in the comments below. And for anything and everything related to diabetes, make sure that you follow us. We are on Facebook, Twitter, and Instagram as @BetoApp. You can also join our Facebook group called Beat Diabetes and stay tuned to our pages. If you have any more queries, please feel free to comment below. Beto app page and Sir's page, Andregn Clinic. We're here to answer your queries. And thank you so much, everybody. Stay safe, stay healthy. Thank you, Dr. Prabhu, again for joining us today.
Thank you, Rosie. And thank you, video team. Thank you, everyone, for your patience. Take care. Have a good day. Good night.